I want to do a little poll here because it's always interesting for us to hear your take. So, um, have you ever heard of exosomes? We're talking about it. It's a hot topic out there in regenerative medicine, but I am excited to see from you guys what you know. That tells us how much education we need to put out for you. So let me get to it. We have chosen the ANTEAGE company. And ANTEAGE has a stellar reputation with their exosomes. Let me tell you what they are. Exosomes are like tiny little bubbles that are created by every single cell in your body. And think of them like text messages that go from one cell to another cell. And they're covered in this fatty layer, and cells love that fatty layer. So when they go knocking on the cell opens up and says, "Come on in." So they're little messages that carry growth factors, cytokines, all these little messages that tell your hair and your skin to act like it did when it was younger. Here's a little picture. So you can see on the left there, the blue cell. You can see that it's sending off microvessels. It has all these products inside the cell. But you see these little bubbles coming out the side heading for this other cell that are called exosomes. And so that's, I mean, we could never see this, but that is how the exosomes operate. So with exosomes, areas of medicine where they're being used. This is so interesting to me. Of course, when I've been looking at exosomes, I'll be honest, for 2 years, we used to have an exosome, a growth factor product in the office, and it went very well. And we, due to supply issues and things like that, we stopped carrying that. And that was so beneficial. I could see such great benefits when we used it. But the technology has just grown in advance. So when I started looking back into bringing exosomes into the practice, I started going down the rabbit hole of what all is it doing? What all can they do with it? This is absolutely amazing. They're using it for wound healing and skin rejuvenation, cardiac and vascular repair. They're using it for nervous system and neural regeneration. Like I was listening to a physician talk about using it in the spinal cord to repair spinal injuries, musculoskeletal and cartilage into vertebral disc, modulation of inflammation and immune regulation. The exosomes bring down the inflammation so amazingly well that they're also great for that. And there's very exciting studies in how they're using exosomes to treat cancer and Parkinson's disease. And as usual, we tripped into getting exosomes in the aesthetic world by accident. We always do. You know, I'm sure with LED light, they sent that to with the astronauts to use in outer space, and somebody got home and they said, "Wow, you look really good. You don't have as many brown spots." And we got LED light. Same thing with exosomes. I'm sure that somebody did something and thought, "Well, your hair looks fuller." And then we started playing with it in the aesthetics world. ANTEAGE was started by scientists who were actually trying to use regenerative medicine to heal diabetic wounds. And that's when they started using the exosomes. This is just a really cool slide to tell you how new the technology is. You can see in 2020 that there were very little information and products being used in general with exosomes. Now at 2024, 2025, it has become almost a $200 million industry that is expected to grow by almost 30% by the year 2030. So basically in 4 years, it's going to grow 30 more percent. It is fascinating to see what they're doing with regeneration. So I want to talk to you about the science and safety of ANTEAGE. I wanted to make sure that we were with a company that has stellar scientific research to support everything that they claim they're doing. I wanted them to have a long enough history that we have excellent reviews on efficacy, safety, lots of white paper research out there for us to read, to understand, and to trust the company. It is very widely used in Georgia and in the entire United States, actually all across the world. So they do produce all of their exosomes in Irvine, California. Everything is made in the United States. In their lab, they process the product from cellular culture to final product. And what I mean by that is they have donors that give tissue, And from that tissue, they cultivate cells and they extract the exosomes. All donors are paid healthy, athletic females ages 18 to 24. The donors were being tested for 20 biomarkers and bacterial markers. They were also doing behavioral to check for lifestyle with alcohol, drug use, things like that. All of this tissue was gathered pre-COVID. And so they gathered enough tissue before 2020 to be used for the next 15 to 20 years. The tissue is cultured and replicated in the lab. ANTEAGE adheres to the International Society for Extracellular Vesicle Guidelines. They are registered with the FDA and under the MOCRA guidelines. ANTEAGE does third-party testing for genotoxicity. The product does not cause DNA mutations in the skin. That is a very, very important statement for you to hear, because when you hear human tissue, sometimes it can be a little bit alarming, but exosomes and ANTEAGE, the way that they produce this product, they are not transferring DNA through the exosomes. Exosomes don't carry DNA. So you're not getting somebody else's code into your system. They are present in 65 other countries, and they have to adhere to their public guidelines. So they have very stringent health guidelines in place for all across the world. So they source their exosomes from two different types of material. First is bone marrow. Bone marrow is the most studied regenerative cell. It can travel easily through the body, repairing damage. It is the most regenerative for skin, and it's extremely anti-inflammatory and very healing. Second, they source from umbilical tissue, in particular, Wharton's jelly. And you've heard that probably in other things. That's I think, used in many things at this point. But in case you don't know what it is, Wharton's jelly is actually found in the umbilical cord as the insulator to protect the umbilical cord. It's rich in hyaluronic acid, and it helps stimulate collagen. And of course, it's a youthful source. I mean, those cells are brand new growing cells. So you combine those youthful cells, exosomes from those youthful cells, and exosomes from the bone marrow, and you have this beautiful combination that can turn back the clock. So how do we use these in the office? We use them topically after we do the lasers. So say Cool Peel, Deca Fusion, Vivace, or Microneedling. We can also microchannel them into the skin with the Hydroneedle. Some of you have had the Hydroneedle MD or the Hydroneedle esthetician. We can microneedle the exosomes directly into the skin with that. And we can also use it in the real delicate tissue around the eyes. It's wonderful for regenerating that eye tissue. And I have a few photographs here for you. This photograph I thought was interesting because the lead educator for ANTEAGE said, this is something that you can show to people that have really good skin to see what sort of improvement they would see, because, you know, she has great skin here, but this really did kick it up a notch. In this photograph, you can see how doing the treatment beneath the eyes, I believe this was 2 treatments beneath the eye area, really helps to tighten and decrease that skin. This is a photograph of 2 microneedling sessions where it was topped with exosomes like I had 2 weeks ago. And you can see this, she's had some significant change in her pigment and texture there. And this is another that has had extremely good results with microneedling and exosomes. So it is said that these exosomes are 40 times more effective than a 40-year-old's PRP. So the exosomes are 40 times more effective than Kelly's PRP. Kelly just turned 40. So you see how young and beautiful her skin is, and this is going to work even better. Here's another example. I do think in that left-hand picture, she is lifting her forehead, and she's not in the right, but oh my goodness, you can tell the difference in the skin quality there, even without the motion. This is melasma. So, with melasma, which if you don't know what that is, you can see in the picture on the left, she has this kind of brown staining. It's not a sunspot or a liver spot or, brown spots. It is kind of a splash of color, and that is more a hormonal discoloration that can be worsened by UV or by heat. And we have to be so careful because lasers produce heat. And we don't want to do a laser for brown and make it worse. It is hard to find a good fix for melasma, and this is proving to be a very nice thing to use in combination with maybe some chemical peels and things like that. But you can see she's had an amazing reduction of her melasma from her CIT. This is the hydroneedle that we use. This is 4 weeks after. So this is microchanneling in a different way. It's the little vial with the needles that we just stamp into the skin. And here is another hydroneedle with exosomes 4 months later. And I have a couple of pictures I want to show you. I have some very dear friends that we used as models, and they've agreed to let me use their photographs. So a big thank you to every single one of you. So this is my good friend, Adrienne. Her daughter's getting married at the end of the month, and I asked her if she wanted to be a model for the Helix Fusion. And whenever you get that Helix Fusion, you can be very red and have downtime for many days after that. But the exosomes will speed up that healing time. So this is before and immediately after her Helix Fusion, which was a big treatment, and she is a fair-skinned person. So, of course, she's going to get a lot of redness. This is days 2 through 4. I was bugging her every day for proof of life. I want to see that you're doing well. And you can see that she was very red, but very quickly she started to decrease in redness and started looking a bit more lifted and a bit tighter. And this is 1 week. So you can see that she's already seeing some nice tightening in her jawline. Of course, she sent me this picture from home, so the angles and lighting are a little bit different, but I am very pleased, and I think she is too with what she's seeing so far. And she is going to look great by the time Miss Lydia gets married. This is Carla, our cool sculpting provider. Excellent, best cool sculpting provider ever. If you're interested in cool sculpting, you've got to come see her. We have a new cool access program that is awesome for getting all your cool sculpting done. Just a side shout out. But Carla donated her face to us for Helix Fusion training. Carla is a sweller like me. We are tender babies. You have to be careful with us. And so you can see immediately after, she is very pink. And then she swelled. And day 2, she was pretty miserable with swelling, but quickly, look at this. It came down. Exosomes were helping with that healing time. She is looking amazing. Days 2 through 4. She actually sent me a picture she did in the office today, and I did not have time to scoot it in here. The amount of lift and volume that we're seeing already with her is amazing. So we'll send that out to you later. But you can see already that she is looking so much better. The redness, the swelling are starting to go away. Probably has a little dry skin still, but that is all going to be healed up. And this beautiful woman, this is Jana's mom. And you can see this is before and immediately after she did her treatment. She's laying back on the bed there. So you can see that she's a little pink. She didn't... Jana, I think you said she had a disappointing response because you were expecting her to get really red. I think she's happy with her response. This is day 2 through 4. So you can see she had a little bit more swelling days 2 through 4. And then this is before and after at 1 week. And there again, this is in her lighting at home. You can already see that we see some smoothing and tightening in the jawline. But we need to bring her back in and get some good pictures in the office so you can really see what's going on. But yes, it's decreasing our downtimes. It is improving healing, and getting all of that nice exosome in there is helping with collagen stimulation, getting the good growth factor in. It is amazing. It is a lot better than PRP, and we were very impressed with PRP. Now, if you are a person who says, I'm just not crazy about a human-derived product, ANTEAGE has also got an answer for you. They have created biosomes. And so with biosomes, they have engineered in their lab product that mimics exosomes. It's the same size, but it contains no human-derived material. These are lab-created growth factors and proteins that we want. They're very highly customizable, and we get great market feedback on those. So you are not bound to having exosomes if you would prefer to do biosomes. So what exactly do exosomes and biosomes do after we penetrate the skin with a device, whether it be a laser or a microneedling or a Vivace, which is radiofrequency microneedling, or our hydroneedle? Any way that we penetrate the skin, this is what's happening. It's going to accelerate healing. They provide regenerative signals that promote collagen synthesis. The clinical studies show faster recovery and reduced downtime. You could see that in the photographs that I just showed you. They reduce the redness, swelling, and inflammation. They're so rich in anti-inflammatory cytokines, which help calm post-procedure irritation and minimize the redness. And they enhance the results. They support organized collagen and elastin formation. They create more long-term tightening, smoothing, pigment correcting results than just doing the device itself. And they improve the hydration and barrier repair. Lipids and proteins in the exosomes assist in restoring the stratum corneum and enhancing the hydration, giving you that glow. And that is, I had another client in today, and I think she's watching. I asked her if I could use her photographs. I did not have time to pop them in, but she stopped by the office to talk about some other things. I couldn't stop looking at her. She is glowing, and she just had her Helix Fusion 5 days ago. And she's a redhead. We all know what that means. It takes longer for the redheads to heal. She is glowing and beautiful. So she was really pleased with that. So why would you pick exosomes and biosomes over PRP? So our PRP is only as good as the donor. And we're upfront and honest about this, but PRP is still good. And we've had some amazing results in our 75, 76-year-olds. Factors in PRP: age, lifestyle, health, vitamin deficiencies you may not be aware of, make it less effective. If you've had a girls' night or a girls' weekend, it might be not as good as it was. You might be dehydrated. There are all kinds of factors that can affect PRP. Remember, all the donors that gave us this tissue were either 18 to 24-year-old females that gave bone marrow aspiration to get the bone marrow, or umbilical tissue. So if you're 24 and under, you don't need exosomes. But if you're older than 24, exosomes would probably give you a better result. Exosomes are created in even higher concentration in the lab than they are in humans. So there are 56 billion exosomes in one little vial. That's amazing. So they come in powder form. I don't know if you probably can't see that. We have a diluent that we will add to it to create the exosomes. So they're very stable. I keep these babies in the refrigerator. They just came out to say hello to you tonight. PRP is naturally inflammatory, and that is how PRP works, is we inject the PRP or we put it on topically, and it's going to give you an immune response, and it's going to send all these good things to regenerate tissue, but you have to go through that inflammatory response, where exosomes are anti-inflammatory. It's amazing to see the difference whenever we use PRP versus exosomes in different areas. Exosomes are 40 times more effective than the average 40-year-old's PRP. I think I mentioned that. There's no blood draw, and we don't have to wait on it to spin. So there's, some practical reasons like that, but I think the most important reason is to know that you would be getting a much more stellar product than PRP. Okay, let's talk about hair, because we have done a lot of PRP rejuvenation for hair and seen some excellent results. It is even more amazing with exosomes, and the photographs have blown me away. I've been so pleased with the results. The ANTEAGE MDX Hair Exosome Solution is made with those same awesome exosomes, but they also put a little derivative in there that contains caffeine and azelaic acid. Those are going to help with hair growth. And then they have a shikimic acid in there that is going to help extend the growth phase. So you get an even longer growth phase to help the hair grow. You have to have a little hair. If you have a smooth surface, like a shiny, smooth, bald head, it is not going to make hair grow. But if you have a little bit of fuzzy in the area, and certainly if you just have a little bit of thinning, it is going to be amazing for helping your hair grow. I have a young man I'm very close to, and he was noticing that his hair is thinning a little bit. So we've been doing some PRP, and he's been real happy with it. It's, kept his hair stable. He's not looking to see great results. So when we did the exosomes, and I get a text message saying, "Hey, mom, my hair looks better." Don't tell him I said this, he will kill me. After doing the exosomes, he was so excited, and it makes me so excited because he's been doing PRP, and when he comes home, he doesn't live with me, and I am very thrilled that he saw enough of a result to tell me out of the blue. That is a miracle. I'm going to show you some photographs. So here's before. This is not my young man, but this is before 1 month and 2 months. And you can just see how the hair is filling in. This is 2 treatments. He is also using the home kit. They have an awesome home kit available. And it has a serum that keeps the richness going at home that is available for purchase in the office as well. This is after 3 microneedling treatments in the hair. This is at 3 months. That's awesome. Here's another one. This is after 2 microneedling treatments 8 weeks later. He had a little heart on his head in the left-hand picture, and he is filling in so great. Here's a female. And like a lot of us get, I think I'm even starting to get a little receding in the temples there. And you can see how much it is helping her to fill in and grow. This was after 1 session, 2 weeks after 1 session. That's wonderful. And this is after 5 treatments of microneedling.